Most of you people must know about it. Losing your hair, gaining your weight. You are so moody. You really need me. Trust me, you need vitamin D.
So, what exactly is vitamin D? And why is it essential for our bodies? Simply put, our bodies produce vitamin D when exposed to sunlight, which is why it's often referred to as the sunshine vitamin. It's a natural process where the sun's beneficial rays are like a magic wand, converting into a substance called cholecalciferol vitamin D3 by steroid receptors deep in our skin layers. It is a beautiful example of our connection to nature's healing powers. Our body produces this vitamin because we need it to regulate our calcium and phosphate levels. Calcium and phosphate are crucial for strong bones and muscles, a well-functioning immune system, and proper resistance against infections, especially those that cause respiratory illnesses. Sunlight is an essential source of vitamin D, a vital nutrient that supports bone health and boosts the immune system. When skin is exposed to sunlight, it synthesizes vitamin D, making it an important factor for maintaining overall well-being. Did you know that vitamin D deficiency is a major global concern, affecting a significant portion of the world's population? In fact, 3.31 billion people worldwide lack this essential vitamin, and a staggering 48% of people do not have sufficient levels in their bodies. This health issue transcends borders and affects us all, and it's crucial that we all understand the scale of this problem. The deficiency rate in Asia is particularly alarming, ranging from 60% to 91%. A recent report also reveals that 42% of Americans are affected by vitamin D deficiency, which means 1 in 4 Americans faces this issue. The situation in Europe is slightly better but still concerning, with 37% of Europeans being deficient and 13% experiencing severe deficiency. Interesting, right? So, what do these numbers tell us? Identifying vitamin D deficiency can be tricky because its symptoms aren't always obvious and can be pretty diverse. For instance, did you know that weight gain, dizziness, chronic fatigue, and even mood swings can all signal a vitamin D deficiency? It's important to consider symptoms such as muscle pain and weakness, bone discomfort, slow healing wounds, frequent infections, and even hair loss as possible signs of deficiency. Other symptoms might include mood swings, reduced cognitive function, and excessive sweating. Let's dive deeper into the serious symptoms of vitamin D deficiency. The first and most significant sign of vitamin D deficiency can be a weakened immune system. Adequate levels of vitamin D are crucial for maintaining a healthy immune response. This vitamin helps your body produce natural antibiotics that fight bacteria and viruses. A deficiency can make you vulnerable to infections like the flu or the common cold. Can taking too much vitamin D cause problems? Absolutely. One serious issue that can arise from excessive intake is hypercalcemia, which increases calcium levels in your blood and can lead to kidney stones, severe bone pain, nausea, vomiting, increased urination, insomnia, loss of appetite, and fatigue. So, remember that taking vitamin D should always be done under your doctor's advice. We can't emphasize enough how crucial sunlight and a balanced diet are for maintaining your daily vitamin D levels. You can't get too much vitamin D from sunlight alone, meaning you won't end up with hypercalcemia just from sun exposure. However, protect your skin from harmful UV rays to reduce the risk of skin damage and cancer. Our complex lifestyles require extra care to maintain a healthy body. Most of us simply do not have the time to sunbathe for 20 minutes daily, so we need to compensate for any vitamin D deficiencies with supplements. There are various other reasons why vitamin D deficiency can occur, and certain life circumstances can heighten the risk. If you're over 65, overweight, have dark skin, or live a lifestyle that limits sun exposure, your risk for deficiency is higher. Additionally, If you have chronic liver or kidney diseases, like Crohn's or celiac disease, which affect nutrient absorption, or if you're on medications that interfere with vitamin D metabolism, you might face challenges in absorbing this vital nutrient. Understanding these risk factors can help you make informed decisions about your health. And let's not forget about infants. Newborns have a high demand for vitamins and nutrients, and vitamin D is one of them. If we can bask in direct sunlight for just 20 minutes each day, covering 40% of our skin, it could serve as a primary and adequate source of vitamin D. However, we all know this can be quite challenging in our busy modern lives. So, what about our dietary sources? Our foods? When it comes to obtaining vitamin D through food, our options are somewhat limited. Vitamin D can be found in a few select foods such as fatty fish like salmon, sardines, mackerel, red meat, beef liver, egg yolks, and fortified foods like some spreads and breakfast cereals. So, remember to maintain a proper dietary regimen to ensure you're getting enough vitamin D. For example, a 3.5-ounce serving of cooked salmon provides about 90% of the recommended daily vitamin D intake. Generally, vitamin D comes to us in two forms: one from plant sources and foods available to us, ergo calciferol, or vitamin D2, and the other from sunlight exposure, cholecalciferol, or vitamin D3. So, if sunlight and our diet are supposed to provide us with vitamin D, why can't we just rely on them entirely? The answer is simple. Our complex lifestyles require extra care to maintain a healthy body. Most of us simply do not have the time to sunbathe for 20 minutes daily, so we need to compensate for any vitamin D deficiencies with supplements. There are various other reasons why vitamin D deficiency can occur, and certain life circumstances can heighten the risk. Vitamin D deficiency can also lead to extreme fatigue or exhaustion, affecting bones, muscles, and overall well-being. This deficiency might result in a feeling of lethargy during the day or even chronic fatigue for those with underlying health conditions. It can also affect your eyesight, causing poor vision and improper pupil response in low-light conditions. Your mouth is another area to monitor if you suspect a deficiency. It can manifest as mouth ulcers, commonly known as canker sores. As you can see, vitamin D deficiency symptoms can be wide-ranging and unexpected. So, if you notice any of these signs, be sure to consult your doctor. What does your doctor do? First, they'll conduct a vitamin D test, which usually involves a simple blood draw to assess your levels. If they confirm a deficiency, they will likely prescribe vitamin D supplements. Now, you might be asking, who should take how much vitamin D? Adults and children over 4 who spend little time outdoors or are housebound, as well as those who dress in a way that covers most of their skin, should consider taking a daily supplement containing 400 IU of vitamin D throughout the year. However, it's important to note that excessive intake of vitamin D can lead to hypercalcemia, a condition where there's too much calcium in your blood, which can cause nausea, vomiting, weakness, and frequent urination. So, always consult your doctor before starting any supplementation. The duration of treatment with vitamin D supplements will vary depending on your age and the severity of your deficiency. Adults may need to take vitamin D for up to 10 weeks, while children may require it for about 12 weeks. The best time to take vitamin D is with your meals, as it absorbs better and faster when combined with food. Since vitamin D is fat-soluble, dietary fats are required to be effectively absorbed in your digestive system. If you're taking vitamin D, a daily dose of 400 IU should suffice. Lower amounts are recommended for infants and young children. It's essential to note that people with special medical conditions should be cautious with vitamin D supplementation to avoid dangerous drug interactions. Pregnant women, in particular, need to be vigilant about their medication and supplement intake to ensure their health and that of their baby. Other dietary sources of vitamin D include fortified cereals, mushrooms, and tofu. For vegetarians, fortified plant milk, orange juice, mushrooms, and tofu can be excellent vitamin D sources. And please keep in mind that to find the right vitamin D supplement for you, talk to a health consultant or your doctor and follow their recommendations. Disclaimer: the content on this channel is for informational purposes only and is not a substitute for professional medical advice. Always consult with your doctor before starting any supplement or making changes to your health routine. We are not responsible for any actions taken based on this content.